my name is Yvette Rodriguez. I'm a registered nurse and master's nurse practitioner student at Midwestern State University. Today I'm going to be doing your musculoskeletal examination. So I'm just going to be reviewing the major joints throughout the body. So hands, elbows, shoulders, hips, knees, the back, the spine. So I'll just be inspecting and palpating. So just kind of looking, observing, and putting a little pressure on different areas of the joints, okay?
Okay.
I have washed my hands and the consent has been signed. So with the first part, what we're going to go ahead and start with are your hands and your wrists. If you can go ahead and pick up. So in any examination, you typically will do both hands, both shoulders, both sides of the hips. I'm only going to, for this purpose, I'm going to be doing both for the hands, and then on some of the areas, I'll let you know when I only do one so that it's more noticeable for the camera. So with the hands, we're going to start with the fingers, just in hands and wrists, just inspecting, checking for any inflammation, redness, abnormalities, deformities, any bumps, lumps, or lesions. So everything looks good. Next is palpation. So I'm palpating the distal and proximal joints of the fingers here, just making sure that there's no tenderness or any bumps that can indicate rheumatoid arthritis or forms of arthritis. And then you also check the ulnar and radial here on the sides. Good. Okay. So checking for range of motion of the hands, we're going to use flexion and extension. So you're going to flex and extend, and putting your fingers down. Good. And then we'll also be doing abduction and adduction. Abduction means away from the body, and adduction means together. So if you can open that's great, and then close to your body. Same with your wrist, out and in. Good. Okay. Now with the hands and wrist, if somebody comes in with any complaints of inflammation or pain, there's a few tests that are done. One of the most common complaints, or one of the most common things found, is carpal tunnel syndrome. And there's about 3 tests that are done for carpal tunnel syndrome. It's the first one is Talon's sign. So what we do here is I'm going to kind of extend here, and I'm going to percuss here on the carpal tunnel. And if you feel any tingling or numbness or pain here on the inside radiating down, then that would be a positive carpal tunnel syndrome. Okay. The other one is the Fallon's test. If you can put your hands in prayer position and just push your hands together. If that causes any pain or numbness or tingling, that's positive for carpal tunnel. And the same thing opposite, pushing together. Now the last one for carpal tunnel would be the medial compression test, and that's just finding the medial or median here in the middle, towards the middle. And if you have any tingling, numbness into the first 3 digits, then you would be positive for carpal tunnel. Okay. The other test that can be done for any type of hand fracture is finding the notch here between, put your thumb, there you go. Finding that notch right here and applying some pressure. If there's any pain or discomfort there, then that can indicate a hand fracture. That usually takes a long time to heal and very painful because there's very little circulation coming to this area. The other test that is also very common for somebody who writes or types a lot is the tendinosynovitis. So if you can put your thumb, make a fist and put your thumbs on the inside, and I'm just going to extend a little here. And if you have any pain or tenderness here, that can indicate the tendinosynovitis. Yeah, I think it's still recording. And now the last test that we're going to do is the Allen's test, and that is you're going to open your hands, and I'm going to occlude both the radial and ulnar arteries, and you make a fist, and the hand turns kind of blank blanched or white. Open your hand. I'm going to let one go, and we see that the hand turns pink and the blood flow. Same thing, make a fist. I'm going to occlude both arteries. Open. The hand is blanched and white. I'm letting go now of the other artery, and we see that it starts to turn pink. And that is usually done for venipuncture to see which one is better flow or circulation and make sure that there is flow going into the hands. Okay, so that's it for the hands. We're going to go ahead and move up now to the elbows. Again, just inspecting, making sure that there's no abnormalities, deformities, inflammation, redness, bumps, lumps, or anything out of the normal. And then we're going to palpate. So I'm going to palpate for the purposes of this video just on this side so that you can see the palpation. But you palpate the acromion process, which is the pointy process of the elbow, and then here on the sides, any pain or inflammation, any bumps there. Good. And range of motion for the elbows is going to be flexion and extension, and then we're going to do pronation and supination. Good. And so that shows that the elbows have good range of motion. Now moving on up to the shoulders, again assessing or inspecting first for symmetry, making sure that there's no abnormalities, any bumps, lumps, that there's not a shoulder drop, which sometimes can indicate a dislocated shoulder. So after inspection and finding the symmetry and everything looks okay, I start here at the suprasternal notch, palpating up the clavicle to the acromion process, which is the pointing process on the top of the shoulder, and then right medial to that is the AC joint. And then here you also can compress to see if there's any pain or tenderness, and the biceptal groove here. Good. Same thing starting at the suprasternal notch, palpating up the clavicle, making sure that there's no bumps or lumps, any tenderness. Now, range of motion for the shoulders are going to be flexion, if you can do forward, and extension all the way back, as far back as you can. Good. And then abduction away from the body, and adduction crossing the body. Good. Now, there's also another one for range of motion of the sternal, which is, the shoulders, which is the internal and external rotation. So you're going to bring your head back to scratch the back of your neck, and then external, kind of bring it back and try to touch as far back the scapula on the opposite side. Good. Now, that's the typical assessment for the shoulders. If somebody were to come in with complaints of shoulder pain or injury, there are other tests that can be done. Some of those tests include the speed test. If you can make your hands into a fist and just kind of bring them out for me like that. I'm going to apply pressure down, and you're going to try to keep your arms right where they're at. Good. Now, if she felt any pain or discomfort coming up here where the stress, that could indicate injury there in the biceptal groove, or maybe even the rotator cuff or meniscus. The other one is the Neer's test. So I'm placing my hand here back on the scapula to kind of hold it in place. You can open your hand straight out, kind of hyperextend it, I believe, this way, and then just bringing it up. Now, if she has any pain or tenderness, that could also indicate injury. The other one is the apprehension test. So again, holding back here the shoulder and the scapula down, bringing the elbow kind of like a pitcher. You're going to just kind of put it up like this, and then I'm going to bring it up and back some. Good. Now, checking for apprehension, facial expressions, if there's any pain or grimacing, that could indicate And the last one is the, I don't remember, there's one more test to check for meniscal tear or injury after the apprehension. The arm drop. So what you do is you lift your arm, and you're going to bring it down slowly. Good, all the way back to the body. Now, if the arm drops suddenly, if she wasn't able to control that or bring it down slowly, that could also indicate injury to the shoulder. Okay. So now moving on to the neck. Just checking, of course, the spine or the cervical process of the neck back here. Inspecting for any inflammation, any abnormalities, palpating the neck all around. Okay. All the way down to C7, that's where it would start for the assessment or evaluation of the spine. So with the neck, we do range of motion. You're going to flex and extend your neck. And then you're going to turn your head to the right and to the left side. Good. And then you're going to bring your ear to the right shoulder and then the ear to the left shoulder. Another thing that you could ask the patient to do is just to do a full circle both ways to check for range of motion there of the neck. Good. Very good. Okay. Now, if you can go ahead and stand for me. Let's just make sure that the camera is still. Let me see. So it is still going. I just wanted to make sure the camera gets, so I'm going to go ahead and inspect your spine. You're going to go ahead and turn for me. I want to make sure that they do get this here in the video to observe. So starting from inspection of the spine, you check for that natural S, the concave and convexity of the spine, where it kind of goes in here, then out, and then again in here. Starting from C7, you palpate the cervical spine. If there's any drop, or hanging of, then that would indicate, and that's all the way down to the buttocks or to the coccyx area of the bottom. You also palpate the paracervical muscles. Make sure there's no tenderness, bumps, inflammation, or pain there. Now, I'm going to check for to make sure that the spine is straight and there's no curvature in the spine. If you can bend over as much as you can, if you're able to touch your toes, there you go. And you just kind of palpate the spine to make sure that that comes down nice and straight. And this is where you would check for scoliosis, also in pediatric assessments as they're growing, which many times is when you can kind of detect a little bit more. Okay. Now, range of motion, you will twist to your sides, just kind of twist that way, and then bend. And then bend. There you go. Good. And then bend to the side. And there you go. Perfect. Good. Okay. And then we're going to go ahead and move down to the hips. So you can go ahead and have a seat again, and I'll get on the other side so that it's easier for them to see the assessment here on the camera. Good. So with the hip assessment, you do start with inspection. If somebody was coming in specifically with a complaint or a concern of hip pain or injury, you would ask the patient to undress so you could really look at symmetry, inflammation, redness, or any deformities or abnormalities. But in this case, we're going to do it with the clothes on and just, so that's what you're inspecting for. And then with, if you want to go ahead and lay here on your side, it's a little hard since we're limited on space. But we're going going to do range of motion of the hip. So flexion and extension would be forward, leaving your knee straight, forward and backwards. And then abduction and adduction would be abduction and then across the body, adduction. Good. There's also an internal and external rotation of the hip. So that would be bringing this here, just kind of me bringing it out and then back and just kind of rotating. So that's for range of motion of the hip. Palpation of the hip would be here, finding this, and back here, finding kind of what's known as the butt bone. And right in between there is the sciatica, and you apply a little pressure here. Not too much, being sensitive to, some people have a very sensitive sciatica, but if there's any pain there, then that could indicate some type of sciatica nerve injury or sciatica nerve. The other joints here are the two dots at the sacral area. So the endosacral joints or notches, those are the two dots at the lower part of the back. So you do find those and kind of palpate there just to make sure that there's no injury. Good. So if you want to go ahead and lay now on your back, we're going to go ahead and move on down to the knees. And let me move this so that my professor could see a little bit better. Good. Okay, so with the knees, again, inspection. I'm going to just pick up your pants a little bit so I can see the knees. Inspection for any abnormalities, swelling, inflammation, any effusion or fluid, any redness, bumps, lumps, so anything like that, which they look good. And so then we also are going to examine the range of motion of the knee. So flexion and extension, good. And then, so with that, then you do, and then also with the knee is abduction, and so bending the knee and then just bringing your leg out and then adduction. Okay. So with that, that's the range of motion of the knee. Palpation of the knee is palpating from the top where the femur comes down. You find the kind of frame the knee with the two from the tibia down here and the femur, and then the patella, and right below the patella. The patella should be more here. Good. So you find here those notches on the sides of the knee, and if there's any pain on when you push there, that could indicate some type of injury. Some of the other tests is applying pressure from the lower or distal part of the femur, applying pressure down. If there's any effusion or fluid buildup, you'd be able to see it and really palpate that there in the inside and the inner area of the knee here. And then there is to check for the ACL and PCL. There's the anterior drawer test and the posterior drawer test. So bending the knee like this and using your finger pads, you kind of bring it back, and you're supposed to sit on the patient's foot just to apply a little bit of pressure. I won't do it at this point so that I don't cover the camera because of our space, but just so that you see, you would pull here, and that would be and then you would get the same thing but push back. And if there's any pain on either one, then that would be indicate either ACL or PCL injury. And then there is moving down to the feet. I'm going to take off one shoe here and your sock just so we can, I'll just do it to one just so that we can get, for assessment purposes. but in a real life patient, you would do bilaterally and compare. But inspection of the foot, of course, checking for any abnormalities, redness, swelling, um, bumps, lumps, or deformities. And then you palpate. So you palpate the lateral and medial meniscus here on the sides and on the inside, which are the bony prominences of the ankle here. And then the calcaneus, which is the heel, and the metatarsals, which are the kind of like the toe bones, or what is on the top of the foot. And then again, of course, the toes, just to check for any pain or injury there. Range of motion of the foot is, again, flexion and extension. Good. And then you would do abduction and adduction. Good. So that's, you can also do with the foot the same as the neck, and kind of ask the patient to kind of put their ankle or their foot around in a kind of circular motion to check for range of motion. Good. And so if you don't feel any pain, if any of these areas don't have any pain or tenderness during the assessment, then that means that there are no injuries or indications of any type of arthritis or other causes of pain and injury. And that concludes our musculoskeletal examination for today.